What's up, guys? Today we have a arrhythmia question. Let's get started. A 50-year-old man presents with heart palpitations that started 3 hours ago. His ECG is shown. He gets a radiofrequency catheter ablation to terminate his arrhythmia. The ablation should create a conduction block through which of the following areas? Now, the ECG blow is showing a soft tooth pattern. Okay, with this soft tooth pattern, we're going to immediately think about atrial flutter. Now, where does atrial flutter begin? Atrial flutter is going to begin in an area called the cavo-tricuspid isthmus. Okay, so this is an abnormal tissue that is going to be in the right atria, and this abnormal tissue is going to propagate an electrical impulse, and so it is going to have this circular pattern. It is going to create this electrical circuit that is going to keep contracting the atria, which is going to cause an arrhythmia. Now, the name is going to tell us where it is located. Cavo for inferior vena cava, and tricuspid for being next to the tricuspid valve. So this tissue is going to be between the inferior vena cava and the tricuspid valve. So cavo-tricuspid isthmus is the abnormal tissue that is going to cause atrial flutter. Now let's go to our answer choices. So our answer is going to be B, which is area between the tricuspid valve and inferior vena cava in the right atrium. This is where atrial flutter is going to start. Answer choice A is accessory pathway bypassing the AV node. This is Wolff-Parkinson-White syndrome. With Wolff-Parkinson-White syndrome, we will have three findings in the EKG that we need to be aware of. First, we're going to have the delta waves. Second, we're going to have the widened QRX complex. And third, we're going to have a shortened PR interval. Answer choice C is ostia of the pulmonary veins in the left atrium. Pulmonary vein ostia is going to be the origin for atrial fibrillation. Atrial fibrillation is going to have the characteristic EKG findings of regular intervals, regularly irregular intervals, as well as an absent P wave. And let's go to these EKG findings, as well as varying RR intervals with atrial fibrillation. So varying RR intervals, regularly regular intervals, as well as absent P waves with atrial fibrillation. And with Wolff-Parkinson-White, we have the delta wave, the shortened PR interval, and the widened QRX complex.